Canton's Morning News with Pam Cook continues now.
We all know it's the holiday season, and experts saying, hey, you know what? Make sure, much like at Thanksgiving, you really slim down your holiday gatherings, preferably the people who are inside your own home and staying in your own home. But if you do have to travel, if it's unavoidable for you, we've got some tips this morning on how to keep safe with Dr. Jason West, founder of the West Clinic and Integrative Healthcare Center. Dr. West, good morning. What can people do to stay safe if they are going to travel during this Christmas week?
Well, thanks for having me. And the first thing that I tell people is, follow the normal rules to be as healthy, as clean as possible. I think that washing your hands is underrated as far as a health topic. And then the other thing is do your best to do your social distancing. And then I tell people, look, vitamin A lubricates mucous membranes. Vitamin D3 helps against upper respiratory infections. Zinc turns on your immune system. Good old vitamin C is really important for regulating cell-mediated, or what we call viral immunity. And so if we're doing some of that stuff and we're washing our hands and we're trying to do social distancing and wearing your mask and everything else, I think that is the best that you can do considering the circumstances.
Doctor, not only do you spend a lot of time taking care of patients, but looking into this and researching and understanding maybe more so than those of us who are non-medical professionals do. What do you think, now that we've got a vaccine, what is a realistic time frame where some of this, not that you're never going to want to wash your hands, you know what I'm saying, but that some of this is going to scale down as the numbers in terms of coronavirus begin to back off? Any idea in terms of months?
Well, that's a really good question, and of course I'm scouring the medical literature and looking at things just like other healthcare professionals. We're looking in our crystal ball, and the big answer is we kind of don't know. We all got pandemic fatigue. We all want this, to disappear and go away, and when it is going to happen, even the CDC says with the vaccine that's coming out, it doesn't necessarily signify the end of the pandemic. I mean, it's not like it shuts off December 11th. We've still all got to do our part on, limiting our contact with sick people. And again, doing everything that we know how to be healthy. That's what is going to make this thing allow life to go back to normal.
Dr. Jason West of the West Clinic, our guest on Canton's Morning News. I'm Bill Morgan. And Dr. West, when people come into your office and they're saying, and at that time, they're healthy, maybe you've already touched upon some of the ways they can stay healthy, but what are some of the more common questions you're getting from patients?
Well, one of the biggest questions is, when this thing first started, I had about, 20% of my patient population was in a bunker somewhere chewing their fingernails off, thinking the world was going to end. And 20% on the other end were saying, hey, it's a big hoax, so I don't believe any of this. And 60% in the middle were saying, hey, just tell us what to believe. What should we be doing? Is there something that, is it as horrible as they say it is? Is it political? I mean, all of that stuff. And now it's all shifted. For a while, everybody was saying, how do I do things to not come in contact with the coronavirus? And I keep telling them, look, that's the wrong thinking. I think that we're all going to come in contact with it. I think it's unavoidable. And one of the things that we've lost in the media is, there's a lot of people that have been infected, and unfortunately there's people that have died and had complications. But there's also a lot of people that are recovering. There's a lot of people that have been exposed to this that have mild or they're asymptomatic. And the difference between the people that are getting sick and the people that aren't getting sick and recovering is, again, going back to their immune system. So when I'm telling people, look, get your immune system in order. Do those things that we know that Grandma did and about the chicken noodle soup and about vitamin C and vitamin A. If we're doing that, then when we do come in contact with it, it's going to be less invasive than if we were sick.
Dr. Jason West, our guest. And Jason, as we wrap up our conversation, tell me when somebody should go and get tested outside of the obvious. If you have symptoms and, boy, you're not feeling well, obviously you want to get that taken care of. But should just anybody go and get tested? Where are you at on that in terms of the advice you give?
Well, I don't see a reason to go get tested unless one, you're showing symptoms, or if it's a requirement for, your job, or if you need to go somewhere where they're requiring you to get tested, perhaps in airlines or, a public venue event. But if you're not having any symptoms, what I would recommend is, hey, do what you're doing now, and do your best to not spread it to any of your loved ones or your family members, which again is washing your hands, keeping your social distancing, getting your body in check, and then what I say from there is live your life as best you can with the precautions and safety measures that we know are significant, and then let's go back to normal life.
Dr. Jason West from the West Clinic, thanks for joining us this morning on Canton's Morning News.
Thank you, and please have me again.